Hello, today we're going to be performing a deep pore cleansing facial using the Theraderm Skincare Back Bar System. Our patient today is Darla, and what I'd like to do is just ask Darla a few questions. It's good to consult with your patient, find out if they're using any kind of medications, what their skin type and condition is, and some lifestyle questions to find out whether they're predominantly indoors or outdoors. So Darla, tell me a little bit about your skin's condition first of all. Are you having any problems or concerns?
Right now, I'm really dry and dehydrated.
Okay.
My skin is really tight, and I'm starting to have issues with my T-zone area.
Okay.
I'm starting to break out around my nose. I've noticed some pores being big, and then I'm starting to break out around my mouth area.
Okay. Do you notice like any blackheads or anything like that in the center of the face?
Yes.
Okay. All right. And so tell me a little bit about any medications or any kinds of allergies or sensitivities that you have.
I've noticed I've been sick recently, and my face is really dehydrated from the antibiotics I've been taking.
Okay, so you kind of noticed a change from that. Okay. And tell me a little bit about your lifestyle. Do you work indoors or outdoors? Do you participate a lot in outdoor activities, or what's that like?
I basically work indoors, but on the weekends I'm outside all the time.
Okay.
So,
Do you generally wear sunscreen when you are outdoors?
yes.
Okay. Okay. So you're a good sunscreen wearer.
Yes.
All right. Well, very good. Well, we're going to get started then with this deep pore cleansing facial. Okay. So once you have your patient prepped and ready to go, you'll just want to start with the Theraderm cleansing wash. I like to always get my hands a little bit wet first. Take out one pump. And then just gently glide over the face and neck. Just use light feathering circular motions just to help lift any dirt, oil, or makeup from the skin. And I like to make sure that the product is on the skin for at least 1 full minute. You can go close to the eye area. Remember, the product doesn't have any acids or irritating ingredients. And I do like to go over the lips just to make sure if any lip makeup product is removed. Okay. Now we're going to use a warm towel to remove the product. Does that feel okay?
Yes.
Okay. This is a nice treat. It's very relaxing. We're focusing mainly on Darla's face today, but sometimes patients will change into a smock, and you can go ahead and carry this down into the décolleté area. I like to wipe over the face twice just to make sure that I lift all of the product and any debris from the skin. The nice thing about this particular cleanser is that while it's gentle, it's very effective in lifting makeup, even stubborn makeup. And it leaves no residue on the surface. Once the product has been sufficiently removed from the face, you will want to proceed by grabbing an absorbent cloth like a Kleenex or paper towel. I just break a little spot in the center for their nose and go over the skin and place that to absorb any water from the pores. The reason for this is that we're going to follow with the new Peel Natural Enzyme Peel. And this product has to be put on an extremely dry surface. If you use just a terry cloth towel to dry the skin, it will not work because all the water has not been absorbed from the pores. However, just gently pressing, again, a Kleenex or a paper towel will pull the water out of the skin. So once the skin is thoroughly dry, making sure, of course, to hit those eyebrows and the hairline, then you can proceed with the next step, which is going to be, again, the new Peel Natural Enzyme Peel. 1 pump is generally sufficient, again, unless you're going to be working with the décolleté, and then you may want 2 pumps. Just spread the product evenly over the face, and once it's all spread out, You can begin to massage in light circular motions on the skin. This helps the papaya enzyme to grab the dead skin cells and lift them from the surface. The nice thing about using this type of an exfoliant is that it doesn't have any type of synthetic beads or particles that traditional scrubs have that could cause some cuts and even some just abrasion, mild abrasion on the skin. This, as you saw, was a clear gel that's put on the skin, and only now, as we rub in a circular motion, is it becoming gritty. This, of course, is the dead skin cell that's balling up on the surface. And because this is a non-acidic formula, it also has no irritating qualities. In fact, there are hydrating botanicals, there are antioxidants, and there's even a peptide infused in this formula. Now that the product has sufficiently balled up on the surface, that takes about 2 to 3 minutes, we'll use another warm towel to remove the product. Again, this is very soothing and relaxing to the client. I like to leave the towel on for just a minute or so. Enzymes get very active when heat is introduced, and we want those enzymes to completely rid the skin of dead skin cells. Okay, so just lightly go over the skin with the warm, wet towel to remove the surface product. And now that we have completely removed the new peel, we're going to move on to the fruit acid exfoliant. I'm going to grab 2 of the Gentle Action applicator pads, wet both of the pads thoroughly, and then just evenly and lightly go over the skin one time. No scrubbing action is necessary and can be a bit abrasive. This sufficiently preps the skin for any treatment that you're going to do to address the conditions that you talked about earlier in your consultation. We talked about the fact that Darla's skin was a little dehydrated, but she was concerned about some blackheads and some breakout that she's had in the center of her face. So we're going to treat that condition first before we go back and work with the dehydrated quality of the skin. Okay, what I'd like to do now is just go ahead and look at Darla's skin now that we've cleaned the surface. And I do see where there are just a little blackheads, a little bit of pore structure in here that she's speaking of having some breakout. So what I'd like to do is use some steam to help dilate the pores. And what I'm going to do is use the Reversion Acne Control Clarifying Cleanser. The reason for this is because the salicylic acid content is fairly mild. It's only 1%. But it's able to break through the little waxy, oily plugs or blackheads that are in the center of the face. So what I want to do is just apply a light film of that cleanser over the skin where we have the problem. And I want to steam the skin with this product on for about 5 minutes. Now that the product has been on the skin and under steam for 5 minutes, we can go ahead and remove the product. We just want to lightly go over the skin where we had the product just to remove the Reversion Clarifying Cleanser. Once the product has been removed, we can proceed to performing some extractions. The technique I use is just to use good Q-tips, and when I say good, try to get the Johnson & Johnson that has more cotton on the tips. Grab several of these and just begin to gently roll the 2 Q-tips together, pulling apart and rolling together. It shouldn't be extremely uncomfortable. Just gentle rolling will help ease any blackheads or debris. It will express that from the follicles and give her a clearer complexion. Okay, now that we've removed the debris from the follicles, the blackheads and so forth, we want to just kind of go over the skin one more time to make sure that it's completely disinfected with the fruit acid exfoliant. Just a very light wiping action over the skin one time is sufficient. Now we want to start addressing some of the concerns that Darla had regarding the dry, dehydrated nature of her skin. The first thing that I would like to do is work with the OPC Reparative Serum. Just a couple pumps is all that's necessary, going over the neck and the face evenly. The OPC Reparative Serum helps to calm the skin. It feels very good. It's in a light aloe base. You can just gently massage this into the skin. Some estheticians like to use their ultrasound, their high frequency, their galvanic current, just to help drive this product into the skin. Once we've achieved that, I like to grab the Peptide Repair Eye Cream, taking about 1 pump and just circling around the eye area. This helps to address any fine lining, but also any dryness or dehydration in the eye area. Once that product has been massaged into the eye area, I like to take a couple cotton pads, saturate them with water, and then add a pump of the OPC Reparative Serum. Again, this is a very cooling product for the eye area that offers some antioxidants and some hydrating qualities. And then just add a cool compress to calm the skin completely down after having anything like extractions or doing any other of your aesthetic treatments, microdermabrasion, dermaplaning, anything of that nature. After 2 or 3 minutes, I just remove the cool compresses, remove the eye pads, and follow with the Eternox Peptide Cream. I like to use a liberal amount of the peptide cream just to have enough slip and time to massage the skin and the neck area for the client to have a comfortable, relaxing experience. Remember that the Eternox Peptide Cream is oil-free, so it's safe to use on any skin type. All right, so after you've thoroughly massaged the Eternox Peptide Cream into the skin, you will want to use some of your Platinum Protection Facial Sunscreen. And this product not only protects the skin from the UV, but also adds an anti-inflammatory ingredient. Zinc oxide has been known to really help to soothe and calm the skin. Remember, of course, that it is oil-free, so it's also safe for all skin types. Okay, once that product has been put on thoroughly to cover the whole face, I like to finish the treatment with just a small amount of the anti-aging lip complex. Okay, so I just apply that with a Q-tip on the lips and slightly on the outside edge of that vermilion border there, just to hydrate thoroughly. I kind of wipe that in the skin. Okay, and we have successfully treated Darla's skin, not only to address the concerns with hydration, but also with a little bit of the clogging in the center of the skin. How does your skin feel, Darla?
Feels great.
Good. Okay, so we've concluded our deep pore cleansing facial with Darla. Darla, how does your skin feel?
Feels very hydrated and soft and moist, like I've got a lot of moisturizer back in my skin.
Okay, good. All right. Well, her skin does have a really nice, healthy glow, and we can see it certainly looks more hydrated. One of the things I would like to do, Darla, is give you some products to take home with you. This is often a good idea to give your patients some of the products so that they can become more familiar with them at home. Darla, these products are what we use today, and I would like for you to try these out. There are instructions on the back. This lasts about 10 days, and if you would, I'd like to know how they performed for you. Give me a call in about 10 days, and let's just set up a follow-up appointment.